When the sciatic nerve is unhappy, you're unhappy. So what is sciatica? Sciatica is the inflammation, irritation of the sciatic nerve. The sciatic nerve travels from L4, L5, it forms from L4, 5, S1, 2, and 3, and it forms the biggest, thickest nerve in your body. And let me tell you, when the sciatic nerve is not happy, you're not happy. What causes sciatica? Well, there is a plethora of situations or things that can cause sciatica. Some simple things would be a pelvic misalignment, a lumbar misalignment, very easily fixed. Even tight muscles, the piriformis muscle and the glute can cause some tension on the sciatic nerve. That can create problems. But there are more severe or more difficult things to treat. Things like degenerative disc disease, a disc bulge at L4, L5, for example, or a herniation, spinal stenosis, where there's that crushing around the spinal cord and the nerves. Anterolisthesis, where there's a shift forward in one of the bones. There are many things that can cause sciatica. The key, though, is trying to find the cause to get the right treatment to fix your problem. Symptoms can range from very mild, intermittent, come and go. It can progressively worsen. That is why sciatica is not easy to treat, because it affects everyone a little bit different. So trying to find the underlying reason why you have sciatica will go a long way in fixing the problem for good. One easy thing you can do at home is called the sciatic nerve flossing. So visualize flossing, and it's the same thing with the big sciatic nerve. You can floss that nerve kind of through a range of motion, through tissues, through fascia. It can break up adhesions, and it can help reduce some of the irritation of the sciatic nerve. I'm going to show you a very simple thing you can do at home to help give you some much needed relief. So with this stretch or exercise, you need to be in control. This is not a forceful stretch. And if this does irritate it, because for some people it will, then this might not be for you. But for those that want to try something in the comfort of their home multiple times a day, this is a fantastic stretch. So you want to visualize the sciatic nerve running down through your glute, down all the way to your foot. And you want to visualize us moving or flossing the nerve through those tissues. Very simply, we're going to sit up straight as always. We're going to pull our shoulders back in a neutral posture. And what we're going to do, as we extend our leg, we're going to extend our head at the same time. So we're going to come like this. And then come right down, and we go into flexion with the head. Of particular importance is when you do this with your leg, you really want to make sure you're dorsiflexing or taking your toes and trying to touch the front of your leg here. So we call that dorsiflexion. You want to really squeeze that up as you stretch that nerve underneath. And at the same time, we're going to extend and come down and flex. And we're going to extend, dorsiflex, and come down. You want to do these movements in unison together, so we literally are flossing that nerve. From a little bit different further away, again, we want to do this with neutral posture, shoulders back. We want to extend up, dorsiflex, really pull those toes up, hold for a second or two, and then flex forward and relax. And then again, come up and down. Dorsiflexing, you want to pull that up. You want to hold this for 2 to 3 seconds. Come down nice and slow and gentle into flexion. And we'll do one more. All the way up. Squeeze. You should really feel that in the back of your leg. And flexion down. Now this goes without saying, you want to do the affected side. However, I'm all about balance with my patients, so I do believe that if you're doing the affected side, you should still do the stretch on the opposite side as well, just to keep things in balance. As always, I hope you enjoyed this video. If you have a question, comment below. I'll absolutely answer it. Like the video. If you like videos like this, please subscribe to our channel. We're going to be putting more and more content out there to help you help yourself at home. Until next time, be well.